Hello and welcome to another issue of the Brain Discovery series. My name is Ellie and this is Dr. Nedd. Dr. Robert Laskowski describes concussion as a silent epidemic in his book Brain Neurotrauma. Dr. Nedd, I know you also discuss this in your book as it's even on the cover. Can you tell us a little bit about why concussions are considered an epidemic and why a silent one?
Well, I'm glad you brought it up in this way, a silent and an epidemic. Silent because most individuals out there have limited knowledge as to how common this condition is. It's often misdiagnosed as other conditions. As a clinician myself, I often see patients that come to me with diagnosis of autism or attention deficit disorder or bipolar depression or schizophrenia, when in fact they've had a concussion or traumatic brain injury that went unrecognized and responsible for many of the signs and symptoms that they experience when they come to me. Another issue is that of the improper definition.
Right.
And over the years, we've had not clear definition of what a concussion is. And of course, as the science of the brain is evolving, we now have better ways of defining it.
We do go over that in our last video, so check that out.
Now, a third issue is that there are lots of people that exist in the universe of brain injury that have suffered the brain injury, but may have felt to have recovered, only to realize under certain stressful conditions, the symptoms recur. But during those periods of times, the symptoms they experience may not be attributed by the clinicians or by the person or the families to the injury that occurred many years ago.
Interesting. Okay, so just to clarify on what an epidemic is a widespread occurrence of a particular phenomenon or disorder or disease. So can you elaborate on how concussions are an epidemic?
Various studies, what we call epidemiological studies, have been conducted on the prevalence, that is, how much people in a population has the disease or the occurrence, how much of that disease occurs in a period of time, like each year. And if you take concussion, traumatic brain injury as a disorder, about 2.5 to 3 million people in the United States experience this disorder per year. Worldwide, somewhere between 43 and 50 million persons experience the condition. Now, it's interesting to note that according to a study done by J.S. Delaney, 88% of persons who've suffered a concussion go unrecognized. That is not diagnosed.
Is this worldwide or in the United States?
That's in the United States.
In the United States. So that's 88% on top of the 3 million.
That is correct.
Wow, okay.
So you see.
So that's an insane amount of people who get a concussion each year and they don't even know.
Correct. Well, they may be aware of certain signs and symptoms, but those persons might not be classified. Okay. Even those who have gone to the emergency room, might have seen a doctor or a parent that might have had their son or daughter hit the head on a cupboard or pool and suffered the symptoms. Okay. So those are the real issues in terms of this being an epidemic. It's large numbers.
So how in these modern times are clinicians still getting this wrong?
Sad to say, there are a lot of biases in our industry. And because of the problems of definition, because the diagnostic tools that we have available in our society to make the diagnosis of brain injury are still evolving. And there are lots of biases in this situation. We need more research in the field of traumatic brain injury. We need more funding to be able to properly classify brain injury and have an understanding of what happens to the brain when it's injured and how the brain recovers. And
so you think that's why clinicians are still getting it wrong?
Correct.
Because there's not enough research.
Well, not just not enough research, but there is not enough of us, physicians who are literally trained to evaluate and treat patients with this condition. In fact, many times we have the wrong premise in terms of how we approach the patient to make a diagnosis of brain injury. That's why we miss it.
So what do you, as someone who does specialize in brain injuries and concussions and TBIs, want other clinicians to know?
Well, first, I believe that as clinicians, we need to educate ourselves in a way that we understand the nature of brain injury, what happens when the brain injury, how the brain recovers, what are the signs and symptoms of brain injury. We must listen to our patients and not be biased because of our previous notions of what a brain injury is. And of course, if we are not in a position, or if you're a clinician, you're not in a position to properly diagnose this, then find someone else who have the education and the understanding of brain injury to help you make that diagnosis, because not making the diagnosis is costly to the individual and the society.
Makes sense. All right, well, thank you, Dr. Nedd. That's all the time we have for today, but stay tuned, everybody, for our next issue of the Brain Discovery series, where we will be discussing neuroplasticity. Thanks.
Thank you.